Good evening, everybody. Happy Thursday, and welcome back to week number 3 of a different perspective series that we're doing here in the office. So if you followed the last 2 weeks, we talked about the immune system. We did a 2-part series on the immune system and the effect that some different things can have on that and how we can actually boost the immune system, look and see if you're at risk and protect you. So if you missed those, click on through, go back, check those out. This week's topic, as you can see, is Hashimoto's thyroiditis. And for those of you who don't know, this is one of the most common autoimmune conditions. Plagues a ton of people in this country. And chances are either you have it or someone that you know struggles with Hashimoto's. And so we're going to talk today a little bit about the medical perspective and what our perspective is as wellness way practitioners. So without further ado, we're going to just jump right into this here. So look in here. There we go. So starting off right away, medical definition of Hashimoto's thyroiditis. So we have to just understand what the baseline is and what Hashimoto's is. So it's an autoimmune condition of the thyroid gland. That's just the basics of it, right? So if we look at the Mayo Clinic's definition, when the immune system attacks the butterfly-shaped gland in the neck, the thyroid. So right here in the front, if you're not aware of where the thyroid is at. Initially, the inflammation of the thyroid causes a leak, resulting in an excess thyroid hormones, which would be hyperthyroidism. Over time, the inflammation prevents the thyroid from producing enough hormones, which then becomes hypothyroidism. Most of the time when people present to their doctor or to our office with Hashimoto's, it has become hypothyroid at that point. It's not typically seen as hyperthyroidism. That would be less common, but still possible. Symptoms include fatigue, unexplained weight gain. Treatment with synthetic hormone medication is usually effective. So the medical system is already pushing towards treatment with synthetic thyroid hormone. We're going to talk a little bit about that as we progress through here today. So the key takeaways I want to get from this medical definition is that, number one, it starts with inflammation, right? So if we can work on reducing systemic inflammation, we're already going to be a step ahead of the game. And that's one of the big things that we focus on here in the wellness way. It can be either hyper or hypothyroid symptoms. So for those of you who don't know, hyperthyroidism is going to be associated with things that bring you up. So anxiety, increase in metabolism, weight loss, difficulty staying asleep, thin or brittle hair, things like that. Hypothyroidism, which again is more common, is going to be things that bring you down more. So decreased metabolism, difficulty falling asleep, hair that's falling out, things like that. So the symptoms of those can be very similar and also very contrasting. So it's important to talk to somebody, one of the wellness way doctors, about what specifically is going on so we can understand what may be happening in your body specifically. Now, looking at diagnosis of Hashimoto's. So the medical system, it's very difficult to diagnose Hashimoto's. One reason for that is that there may be little to no signs or symptoms that are unique just to Hashimoto's. So really, Hashimoto's is a type or a cause of hypothyroidism, or in some cases hyperthyroidism. And so we can identify the fact that there's hypothyroidism by looking at your labs. Most of the time, the medical system, the medical doctors are not going to run all the antibodies and actually find out that you have Hashimoto's specifically. And that's a really important key because the treatment needs to be different. Depending on why you have hypothyroidism is how we're going to go about treating that, and we'll talk about that as we get through the presentation tonight. So the diagnosis of Hashimoto's thyroiditis may be made when patients present with symptoms of hypothyroidism and laboratory testing of hypothyroidism, which is going to be an elevated thyroid stimulating hormone, or TSH, with or without a low thyroid hormone. And this is one of the big keys here is the medical system is they're already starting to discount the value of that T4 number. So if your TSH is high, it doesn't matter where your T4 is at, we're going to just go ahead and say you have hyperthyroidism or hypothyroidism. So we're already missing the boat a little bit by ignoring some of the markers and just not identifying the differences there. The TPO antibody, when measured, is usually elevated. So when measured, meaning it's not always going to be measured or looked at, and then it may not even be elevated. Now the important thing to remember with elevation of these markers and in and out of ranges is that the medical system's job is to establish a diagnosis. They can't establish a diagnosis until the number becomes outside of the range and falls into the red, right? So a lot of times patients present with all these issues and all these problems, and they get the blood work done, and they're on the high end of the range for TSH and the low end of the range on T4, but both numbers are still in the range, so the medical doctor is just going to say, there's nothing wrong with you, you're fine, come back and see me. And we'll look at that retesting. So if the numbers aren't in range, the medical system's going to say, okay, let's come back in 3 to 6 months, we'll retest, and we're basically just going to wait and see. And I personally don't feel like waiting and seeing is a very good option. You know, we can see that we're outside of the ranges. We can see we're heading down the wrong pathway and you have all these symptoms, so why would we just wait and see when we can start working on this stuff so it doesn't actually have to fall outside of that diagnosis? We're looking at the different approaches. So we're going to talk about the medical approach to Hashimoto's and thyroid. We'll talk about the alternative medicine approach. So some of you may have not gotten the results that you wanted with your medical doctor, so you went to a natural medicine doctor, a functional medicine doctor, and they ran some additional testing. We'll talk about what that approach is, and then we'll talk about the Wellness Way approach and what really sets us apart and differentiates us, and why we get such good results with things like Hashimoto's. So, looking at medical treatment, I'm going to read this because this whole thing is very important. So stay with me because it's a little bit long, but this is directly from the American Thyroid Association's website. So patients with elevated TPO antibodies, which is thyroid peroxidase, that's one of the enzymes that helps create your thyroid hormone, T4 and T3. But so elevated TPO antibodies, but normal thyroid function tests, as in TSH and T4, do not require treatment. So that's already a red flag, right? The first sentence of their treatment is a red flag, which is not good, right? So it's not normal to have thyroid antibodies. If we see any level of elevated antibody in the thyroid, that tells us there's an autoimmune process taking place. So it's not okay or normal to have any level of autoimmune process, and that's very important to remember as we continue talking about this and talk about what the actual treatment needs to be when you have an autoimmune condition. If we can see that there's autoimmune things happening, we need to address it, even if it hasn't affected the thyroid yet. So patients with only slightly elevated TSH, mild hypothyroidism, may not require medication and should have repeat testing after 3 to 6 months if this has not already been done. And this is what I was talking about just a couple minutes ago. They may need to have repeat testing. So we're just going to wait and see, because even though you have all these symptoms, it doesn't fall outside of the range enough for us to do anything. So just continue having all these symptoms, and then we'll just wait and see. So again, first sentence is the red flag, second sentence is a red flag, so we're already off on the wrong foot here. For patients with overt hypothyroidism, elevated TSH, and low thyroid hormone levels, so now the numbers are actually outside of the range, treatment consists of thyroid hormone replacement. So we have an autoimmune condition that's affecting the thyroid. It's affecting the thyroid's ability to produce thyroid hormone. So the medical system wants to say, okay, the thyroid's not producing hormone, we're going to just give your body that thyroid hormone. So thyroid hormone's gone, we're going to give you more of it, everything should be fine. They're completely ignoring the fact that it's an autoimmune condition affecting the thyroid. The thyroid's just the target. The low thyroid hormone is the symptom of the autoimmune condition that's affecting the thyroid. So if all we do is treat the thyroid with thyroid hormone, we're not addressing the bigger picture, which is that there's a disease process that's affecting the thyroid gland. And that's just going to continue to progress and get worse. And as we see down here at the bottom, it says you do have to take this thyroid medication for the rest of your life. So most of us don't want to be on medications. You can't be taking a medication and also be healthy at the same time. So if you've gone into your doctor and they told you that you have this hypothyroid issue, you have to take levothyroxine or Synthroid or a synthetic version of T4 for the rest of your life, they're basically giving you a sentence that says you're no longer going to be healthy. I know better than your body. We're going to give you medication, and that's it. Now, it's very hard to dose thyroid hormone. And so most patients with Hashimoto's thyroiditis will require, again, lifelong treatment with levothyroxine. Finding the appropriate dose, particularly at the beginning, may require testing with TSH every 6 to 8 weeks after any dose adjustment. So they already know it's going to be a long road trying to find the right dose. Now, I don't know about you, but if I were having all of these issues going on, I wouldn't want to have to wait every 6 to 8 weeks to get retested and to try to find the right dose. And I know many of you watching this have already been down that path, and you already know what that's like. And I'm here to tell you there's another path and another direction that we can go in when we start actually identifying what's going on with the body. After that, monitoring TSH once a year is generally sufficient. So when levothyroxine is taken in the appropriate dose, it has no side effects. However, when an insufficient dose is taken, serum TSH remains elevated, and patients may have persistent symptoms of hypothyroidism. So you took the medication and you didn't get better, or when the dose is excessive, TSH will become suppressed, and patients may develop symptoms of hyperthyroidism. So when they say there's no side effects, they don't really mean that. And there's a lot of side effects because it's very rarely dosed properly, which means a lot of times people go in there and they're not getting enough of it, so they still feel the same, or they're getting too much of it. And now instead of having hypothyroidism, you've been on medically induced hyperthyroidism, and everything switches, and now you have just as many problems that are the opposite. So this is not the right approach, and what we're going to talk about in a couple minutes with the way the thyroid actually functions, you can't be healthy and be on a consistent dose of thyroid hormone, because that's not the way the body works, and that's not the way the thyroid works. So looking at the disease specific, the medical approach here. So we talked about it. The medical approach, they're going to test your TSH and they're going to test your T4. Now, Hashimoto's, again, is an autoimmune condition. You have to test antibodies. If you've been to the doctor with these symptoms, you know they don't typically test antibodies on the first visit. And in a lot of cases, you have to go to a functional medicine doctor, the alternative medicine doctor, who's actually going to be able to run those. Or they try to mess around with your levothyroxine levels for long enough that they can't figure it out, so then they test other levels once they've already tried the medication and it doesn't work. So if we look at what synthetic thyroid hormone is, the most two common are going to be levothyroxine and Synthroid, right? So that's just synthetic T4. Now we're not going to talk a lot about the thyroid hormones and how everything works in the regulation, but there's a lot of different thyroid hormones. T4 is not the active thyroid hormone. T4 is the most commonly produced hormone in the thyroid, but it's not the one that acts on tissues. The T4 has to get converted into T3 in places like the liver, places like the gut, in order for it to actually function. So if there's a problem somewhere else with that conversion, you can take all the T4 you want and it's going to do absolutely nothing because it can't convert into T3. And again, we talk about that a lot in our thyroid talk in the office, which we're actually doing in 2 weeks. So if you're in the Sarasota area, or if you want to follow us online at the Wellness Way Sarasota Health Community, we are going to be streaming that thyroid talk. I'm going to talk for an hour all about the thyroid. So if you want to learn more about that, I'd highly recommend joining that group or coming and joining us in the office so you can learn about that. Now, Synthroid is the #2 prescribed medication in the U.S. to the tune of 8.7 million prescriptions per month. Every single month, almost 9 million prescriptions of levothyroxine are written. It's absolutely insane how much of this medication is just given to people. Almost 20 million people a year get prescribed levothyroxine. So there's 300 million people in the country, 20 million people getting prescribed. That's almost 10% of the country that's dealing with this type of an issue. So, say you were tired of the medical approach, it wasn't working for you, now you go to the alternative medicine approach. The alternative medicine approach, they're going to test some of the same stuff, the TSH, T4. Now, a lot of times they're actually going to test T3, so they're actually going to look at what that active hormone is, and they're going to test your antibodies. So now you've got Hashimoto's, you've just been diagnosed as hypothyroid, they didn't know that you had the autoimmune condition. Now they found out that you do have the antibodies. But what's the difference? The treatment is not going to change. It's just the medication that's changing, and the thought process hasn't changed as well. So if you go to the alternative medicine provider, what they're going to give you is a desiccated thyroid hormone. Basically what that is ground up pig thyroid, so it's going to contain a lot of T4. It's going to contain T3 as well, and trace amounts of T1, 2, and some of the other cofactors. So this is a better option because you're getting more of those nutrients, and you're actually giving a little bit of T3, but the thought process is still the same. The thought process is still, the thyroid's not producing hormone, let's just replace that with a medication, and then everything will be fine and dandy. No one's ever really addressing the immune system, and they're not addressing the underlying things that are going on. So when I talked before about how you can never be healthy when you're taking a medication, and the body doesn't just stay at a flatline level of thyroid hormone, this is what I'm talking about. The research actually shows that the daily rhythm of thyroid hormone released from the thyroid gland is regulated by the central circadian pacemaker in the brain via rhythmic TSH secretion. So your body is always just responding and adapting to the environment, and so if something happens, your body has to be able to either upregulate or downregulate thyroid hormone appropriately at that time so your body can get through it. So thyroid hormone is going to go up and down like this throughout the day, weeks, years. So you can never be healthy and functioning properly with a flat line level of thyroid hormone. That's just not the way the body works. So when we start manipulating things within the body, we're overriding the body's ability to respond the way it needs to, and we're going to cause other problems down the road. So then what is the answer? The answer is the wellness way approach, and this is what makes us different, because we're actually understanding what's going on within the body and helping the body function normally. Just because your thyroid has some destruction going on does not mean that your thyroid can't produce more hormone. There's only a couple reasons that you should ever have to take synthetic thyroid hormone, and that's in the case of total destruction or removal of the thyroid. And we do unfortunately have patients that have had thyroid cancer, that have had that thyroid removed, and that's their only choice because they don't have the gland to produce the tissue. But as long as you still have your thyroid, you still have options, and there's still things that we can do to help restore some of that function. But it all starts with understanding, number one, why is this happening? Like I said, Hashimoto's is an autoimmune condition, which means it's an immune system problem, not a thyroid problem. The immune system is attacking the thyroid. So if all we do is give synthetic thyroid hormone, we're never addressing the fact that the immune system is what's attacking the thyroid. We have to address the immune system. So again, autoimmune condition here. An autoimmune disorder is an illness caused by the immune system attacking healthy tissue. In Hashimoto's disease, immune system cells lead to the death of the thyroid's hormone-producing cells. So we are never going to stop destroying the cells if we continually have those antibodies. And giving levothyroxine or a desiccated thyroid hormone does not get rid of the antibodies. So we still have that destruction taking place, which means over the years, the dosage is just going to start creeping up and up and up as the thyroid just gets more and destroyed by the immune system. So if we really want to stop this, we have to address the fact that the immune system is attacking the thyroid. And that brings us to our next question. What caused it? So what triggered the immune system to attack the thyroid? There's a couple different things, but it's really all about the response in the body. What are we doing that's stimulating and triggering the immune system, and why is it responding the way it is? First place it starts is in the gut. So the gut is a huge place where our immune system lives. It's also a huge entry place for toxins and chemicals and things into the body. So if you've heard of leaky gut, it's one of the most common things that ends up leading to autoimmune conditions, because those cells in the gut separate due to stress, toxins, food particles, medications, bacteria, viral infections, and organ malfunction. So when that happens and we get that separation in the gut, things that are supposed to be on the outside of the body get through, and that triggers the immune system. And if we're constantly triggering the immune system day after day after day, we're going to end up with immune system issues, and we're going to end up with autoimmunity. You can see how that happens right here. It starts with inflammation in the gut, leads to food allergies, immune system issues, and eventually autoimmunity. So if we don't ever address the gut health, we can never address the autoimmune condition. The other thing we have to go back to is, if you listened, it said the immune system attacks healthy cells. Now, we know that it's not the immune system attacking healthy cells. Remember, all the immune system does is respond. So if it's attacking a healthy cell, the cell isn't healthy. The immune system is responding to something that's happening there. Now, in the thyroid's a fatty tissue. It has a very high affinity for heavy metals and toxins, but it also has to use up iodine. So if we know anything about the thyroid, we know that iodine is very important. It's the iodine deficiency and things like that in developing countries that causes the goiters and the swelling in the neck oftentimes. But the iodine is what stands the number. So T4, synthetic thyroid hormone, T4 thyroxine, is basically tyrosine molecule and 4 iodine. So that's where they get the T from tyrosine, 4 from the number of iodine molecules that are bound to those tyrosine molecules. T3, the active form of thyroid hormone, is the tyrosine and 3 iodine molecules. So you understand, iodine is very important to make those thyroid hormones. Now, if you remember, periodic table of the elements, we have a column on the right-hand side here called the halogens. I don't care how much you know about the periodic table, that's not the important part here. What we're going to focus on are the 3 things above iodine. So this is iodine right here. Then we have bromine, chlorine, and fluorine. So those are all higher up on the periodic table, which means that when those things are circulating through your body, the thyroid has a higher affinity to bind those halogens than it does to bind iodine. And so if we are trying to bind bromine, chlorine, or fluorine to tyrosine, that's not going to be an effective molecule, and your immune system is going to recognize that there's a lot of those things in the thyroid gland that shouldn't be there, and it's going to start going after those tissues because it's trying to protect itself. So the answer isn't to just give synthetic T4. The answer is to understand where this exposure is coming from for these things and remove the exposure so the body can start utilizing iodine the way it's supposed to, and we're not competing and getting that iodine out of the cell. The other things, heavy metals. So heavy metals, thyroid is a fatty tissue, has a high affinity for storing heavy metals. Things like lead, cadmium, mercury, arsenic are all correlated with thyroid dysfunction and with thyroid disease. So if your body has heavy metals stored in that tissue, it's going to try to wall it off and protect the body from it, hence the thyroid nodules, things like that. And then the body's going to try to get rid of that tissue and destroy that tissue so it doesn't affect the rest of the body, hence why the thyroid's going to start attacking and destroying its own tissue. So again, it's not the thyroid's healthy tissue, it's that the thyroid has absorbed a toxin or something that's in the body that should not be there, that's now triggering an immune response. So we can't just look at the thyroid, say it's not producing enough hormone, and just give synthetic hormone and live our lives happily ever after. We have to understand how the body's functioning as a whole. So once we know why the problem's happening and what caused it, then it comes down to, well, how do I fix it? So it all starts with identifying the problem and then removing inflammation. So if you remember, very first slide, we said thyroid Hashimoto's begins with inflammation. So none of those medications you're taking are ever going to reduce the inflammation in your body. We have to remove the inflammatory triggers. If we look at the things like the stool test, the first thing that it said there, once you get that leaky gut, is food intolerances or food allergies. So this is a food allergy test from a patient that actually came in with Hashimoto's. And this patient had 31 food allergies. So these are 31 foods that are getting through that gut wall, and every single time he ate one of these foods, it was triggering an immune response. He cut all these foods out, and within a couple of weeks, he felt significantly better, and he actually lost 15 pounds as well because he wasn't constantly creating that inflammatory response. Gas, bloating, things like that improved as well. We can't ever fix the body and heal if we're constantly stressing the body out. That's very important. If you don't take anything else away from this, I want you to remember this. You cannot heal if you're putting stress on the body at the same time. So if we're constantly exposing ourselves to things like food allergies, how are we ever going to expect the body to heal itself? We can't. So getting tested and understanding what's happening in your body is very important, because these are not the same for everybody, and you can't just guess. It's not how it works. You have to actually test and know what's going on. Then we look at stool testing. So what was one of the things that caused the leaky gut? Infections. So we can actually test your stool and we can see infections. This was from the same patient, and he had 6 pathogenic infections. And what that basically means is that those infections, those are bacteria that are normal in the gut in very, very small amounts. And when there's dysfunction, inflammation, things like that, they start to grow and develop, and we start to actually have these opportunistic infections where something that should not be causing a problem has developed a problem. And when you have something that's in the yellow, like what this patient had, that means that that's actually documented to cause serious problems. So especially when you're in the yellow, that's a serious problem. So again, this same patient, at this point, we haven't even looked at thyroid markers because we know we can't heal the thyroid until we stop stressing the body and start figuring out what's triggering the immune response. Now when we actually look at thyroid markers, TSH, crazy high. And we have those TPO, thyroid peroxidase antibodies. So understanding how the thyroid's functioning, if you look at the thyroid test here that we ran, you can see significantly more numbers on here than just TSH, just T4. That's because we're looking at the entire thyroid function, the whole pathway there. We want to understand the pathways that are happening in the body and why the body's responding the way that it's responding, because treatment varies depending on what's going on, and we can't understand what's going on until we test. And then the last thing, how about the immune system? We said that an autoimmune condition is an immune system problem. Now this isn't the same patient, but this is a patient who ran an immune panel. I actually talked about this patient in my video last week, but you can see everything is severely depressed. And this is a patient that may at some point develop something like cancer or an autoimmune condition because the immune system is so compromised. So repairing the immune system is going to be vital if we want to get the thyroid fixed as well. So again, if you're dealing with Hashimoto's, if you're still struggling with some of the same symptoms and you haven't gotten any better, you got to remember the 3 questions you need to ask. 1, why is this happening? What's triggering my immune system? What's triggering it to attack the thyroid? What caused that? and then how do I fix it? And if you can understand all three of those, and you can actually take steps to make progress at healing your body so that you don't have to continue taking medication for the rest of your life. And it's stuff that we see in the Wellness Way every single day, patients coming off of medications that their doctor told them they were going to have to take for the rest of their life because their body started functioning normally again. And that's, again, one of the most important things is that we believe at the Wellness Way that the body was designed to function normally, and it just responds to the stresses that you put on it. So if you remove the stresses and give the body what it needs to heal, you can regain that normal function too, and you don't have to have the surgeries and you don't have to take the medications. And so if you're struggling with these issues, I would urge you to please reach out to us or to a local Wellness Way office. If you're watching from somewhere else, you can go to thewellnessway.com. You can find a clinic near you. There's clinics all over the country. If you can't find one near you, we can absolutely help you as well remotely. If you're in the area and you want to learn more about the thyroid, come to our talk in 2 weeks, Tuesday at 6 p.m. So that's 2 Tuesdays from not next Tuesday, the Tuesday after. I'm going to be talking about the thyroid in much more detail for about an hour. We do autoimmune conditions talks and things like that as well. If you want to stay connected, follow us on Facebook, The Wellness Way Sarasota. Follow us, The Wellness Way Sarasota Health Community. 2 different groups, a page in the community. Like this video, share it with people. We want to help as many people as possible, and you helping by sharing and liking this video is the best thing you can do. So thank you guys for staying tuned. Next week, we're going to actually talk about male hormones and testosterone, what you can do to keep that testosterone elevated. Everybody always gives love to the females and talks about female hormones, so I'm going to do the men a favor and talk about what you can do to increase your testosterone. So, thank you guys for watching. Again, like and follow, share the video if you learned something, and we'll see you next week.